find the right answer on NCLEX-style nursing questions? Do you find yourself between two answers and you know the content, but you just can't figure out which one they're looking for on that specific test question? Hi friends, I'm Dr. Meredith Watkins, and this is 360RN. In today's video, I'm going to teach you some strategies for NCLEX-style questions that are going to help you spot the right answer to the questions. And you can remember these different strategies through the acronym SPOT, because nursing loves acronyms, don't we? So S stands for safety risks. Now remember, the NCLEX is a safety test, and the tests you're doing in your nursing classes are also safety tests. The point of nursing school is to make sure that you, as a brand new beginning nurse, are safe to practice and take care of people. So in our exams in class and on the NCLEX, we're looking for basic understanding of nursing safety. And that can be boiled down to a few things. The first one is pressure injuries. Pressure injuries are a big deal for hospitals because, first of all, we don't want our patients getting pressure injuries. And second of all, if they do get them, it's very expensive for the hospital. They have to eat the cost for that. So anything about pressure injuries is going to be a hot ticket on the NCLEX. Fall risks is the next safety thing to think about. So if the patient is at risk for falls, likely you're going to be doing something in the test question about reducing that fall risk or addressing the risk for falls. So can you identify the people who are at risk, and can you make the right choices if they are? The third safety issue is going to be healthcare acquired infections. Now, this is just like pressure injuries in that they're terrible for the patients and they're expensive for the hospitals. Hospitals don't get reimbursed for healthcare acquired infections because you shouldn't get sick when you come to us for help. So there's two specific types of healthcare acquired infections that hospitals track, and they're called CAUTIs and CLABSIs. Now, CAUTIs are catheter acquired urinary tract infections, and CLABSIs are central line associated bloodstream infections. So are you getting an infection because of the central line that we put into you, or are you getting an infection, a UTI, because of the Foley catheter that we put in? So anything that's going to have to do with cleaning those lines, assessing for risk, and getting those lines out as soon as possible are going to be things that they're going to look for on NCLEX. And the final one is medication administration. Do you know how to safely administer medications to patients? And that includes knowing your 6 rights and also proper medication for the different routes that would be involved. High-risk medications like insulin and heparin are going to be of special interest on NCLEX-style questions. Okay, so the first letter in our acronym is S for safety risks. The P stands for priorities. Now, depending on the situation, there's going to be different priorities that you're determining for your patient. So it's important to recognize all of the different frameworks for prioritization and then pick the one that's most important for the situation you find yourself in at the bedside, or in this case, on the test question. And again, these prioritization strategies work at the bedside, taking care of real patients, just like they do on NCLEX. So the first strategy to consider is ABCs. Airway first, so making sure that they have an open tube from the outside to the inside so that they can breathe and bring in air. B stands for breathing, making sure that they're actually breathing in air and breathing out air. And then C stands for circulation, making sure that their heart is pumping, that they've got enough blood pumping through their veins, and that their blood pressure is high enough to get that all throughout their body. Now, if there's anything critical about airway, breathing, or circulation, you're going to address those issues before moving forward. Now, just because someone's there for something related to blood pressure doesn't make it an ABC priority, right? It would have to be something critical that is life-threatening that would cause that to be an A, B, or C. So think about life-threatening issues with airway, breathing, or circulation. Another prioritization strategy is Maslow's, so addressing the hierarchy of needs. So if you have, for example, a psychological issue with a patient or an emotional issue, but there's a medical physical issue that's even stronger, the medical physical issue is going to be more important at that moment. So Maslow's hierarchy of needs is another way to prioritize those questions. Now, the third prioritization strategy is acute over chronic. So we understand that patients have been dealing with things for a long time, but what are they dealing with right now? So in the clinical setting, right now in front of you, what are they in the hospital for? And in the NCLEX style questions, what's the issue at hand? Don't get distracted by the long-term chronic things, especially if those chronic things are stable at the moment. So consider the acute need first. Okay, the next one is least to most invasive. Is there interventions that you can do that are less invasive than something more extreme? For example, if someone is slightly dehydrated, oral hydration would be less invasive than IV hydration. So consider the level of invasiveness, and if two options are available but one is least invasive, choose that one first. The next one is actual versus potential. There are going to be issues where you are assessing for risk factors and possible problems in your patients, but we're looking for actual problems versus potential. So if you have a potential risk for something, but an actual problem that's existing that's important, manage the actual issue before thinking about the potential risks. And then the last one for prioritization is scene safety. Remember that the first priority for us as nurses is to make sure that we are safe to practice. And so scene safety trumps everything else. So if there's a fire, the goal is to remove people and get to safety first. If you are attending to a motor vehicle accident on the road, the goal is to assess that it is safe to reach the patient before attending care. Okay, so those are the 6 prioritization strategies that you can use and help navigate to the right question. So we have S for safety risks, P for priorities, and then O stands for on the spot action. What can you do right now immediately to help the patient? The best way to explain this one is to imagine yourself actually at the bedside of the patient that you are doing the test question about. And what would you do before you left the room? For example, you have a patient whose blood pressure is 85/45, and one of the options on the test question is to lay the patient flat. And another option is to go ask the doctor for an order for IV fluids. Now, obviously, both of those choices are going to help that patient. But we know that if you go call the doctor and wait for them to be paged and call you back and get an order and start an IV, that's a process. In the meantime, you have a patient whose blood pressure is 85/45. What can you do on the spot? Well, lying them flat is going to help raise their blood pressure. And so that's something you can do before you even walk away from the bedside. So on the spot action asks you, what can you do immediately to help the patient? So we have S for safety risks, P for priorities, O for on the spot action, and T stands for the nursing process. Yes, good old ADPI, assess, diagnose, plan, implement, and evaluate, right? ADPI. So we understand that the nursing process needs to be done in order. And just think for yourself, what 2 steps of the nursing process do you think are most important? So we've got assess, diagnose, plan, implement, and evaluate. What 2 steps do you think are the most important? If you said assessment and intervention, I would agree with you. And remember that assessment should always come before intervention. So if you've got a situation on an NCLEX style question, and one of the options is about assessing the patient, taking vitals, checking labs, listening to lung sounds, and the other 3 are all doing things, they're all actions, implementations, make sure you choose assessment first. NCLEX questions can be really intimidating, but they don't have to be. There are specific formats that are used to write these kind of questions. And they're really to get an understanding of how you choose to order your care and what priorities you make with your patients. By using this acronym SPOT, hopefully it'll help you find the right answer, spot the right answer, if you will, on your tests. Now, the best way that you can practice this is have this out in front of you when you're doing practice questions. And then as you're going through the question, think to yourself, which of these strategies is best applied in the situation? Then answer the question, look at the rationale, and see if the strategy you selected was the right one to help you get to the right answer. And if not, think about which strategy would have been better for that case. The more you practice this and align yourself with these strategies, the better you'll do. I hope that helps. Thanks so much for being with me today. Remember, you are smart, you are capable, you are loved, and you got this. I'll see you next time.